And my husband, as you mentioned, an orthopedic surgeon in Tasmania. So we've got a catchment area of about 120,000 people. It is very small. We're right down the other end of the world. And here he was starting to understand that there was an absolute tsunami of metabolic disease hitting us, hitting healthcare, and it's all over the world. But in Tasmania, he'd gone from maybe seeing somebody 20 years ago who needed either a debridement, which is taking off a little bit of the ulcerated skin or dying skin from feet and lower feet, even lower limb amputations as a result of the complications of, I'll say in particular, type 2 diabetes, but it was also type 1 diabetes. But specifically, this tsunami of type 2 diabetes was coming. So you think maybe 70, 80 years ago, we were looking at a tsunami of communicable disease, and we're starting to work out how we could stop those communicable diseases. Well, now there's a tsunami of non-communicable diseases. So these are diseases that appear to have escalated, I would say, since the introduction of the US dietary guidelines in 1977. They've certainly, if you look at the graphs, they've just gone crazy. And so you think, what happened in that time? That's where I'm going to leave you on that bit now. Go back to my husband. So here he was seeing this tsunami of complications of type 2 diabetes in his practice as an orthopedic surgeon. And he said to me, you can never, ever get the sound of a leg dropping into a bucket, a steel bucket. You don't want to maim people. He didn't go into medicine to band-aid sick care. He didn't go into medicine to harm people. And suddenly he just started feeling like that's all he seemed to be doing. He would walk into a ward with people with rotting flesh. And it seemed like sometimes he was walking into a leprosy ward. The smell of rotting flesh is just horrific. And he said, there has to be something I've got to be able to do for these people. Go back one step. Gary was diagnosed with cancer in the year 2000. So he went on his own health journey. And when it was found, it was very extensive. So there was a role for the surgery that he had to have. There was a role for chemotherapy and radiotherapy and all of those things. But at the time, no one ever discussed diet. No one ever looked at the fact that when he had his PET scan, it lit up like a Christmas tree to sugar, to glucose. When they do the PET scan, that's what they're doing. They're putting glucose into your body to see where the cancer cell is and how active it is. If that doesn't, we didn't think of it. I'm a nurse, Gary's doctor, did not think about that. So in 2011, they were saying, we really don't think there's anything more we can do to help your cancer, the spread of it, because we've tried everything, all the drugs, everything else. So Gary decided to look at Dr. Google himself. And he went looking to think, what can I possibly do here? And he came across the work of Dominic D'Agostino and Colin Champ in the US. And they were specifically looking into sugar and cancer and the role that it was playing in potentially feeding cancers and making them more active. And he also came across a book here in Australia called Sweet Poison, written by a lawyer, David Gillespie. And at the time he said, what does a lawyer know about sugar that I don't possibly know? In his medical training, he learned anatomy, physiology, biochemistry. They're trained in that. They might not specifically talk about nutrition, but they're trained in all of those things for the first 2 years of medicine. The next 3 years, 4 years, they spend so much time looking at how to medicate, operate, and band-aid sick care that they forget that glucose, or that starchy carbohydrates, are simply glucose the minute you put them into your mouth. All of these things just started coming into his, I guess, sphere of thought. And so as a doctor, he began advocating people reduce sugar. And this is in about 2011, 2012. And he looked at the hospital, walked around it. There were just junk food vending machines everywhere. Pink ladies, the people who took trolleys around to patients, not only had magazines and newspapers and things, but junk food. And I think we mentioned briefly in our chat beforehand, when I was nursing all those years ago, I used to serve cigarettes to patients and patients smoked. So, here we are with all this junk food now, just absolutely flooding these patients' psyche. And when you're stuck in bed and you've got nothing else to do, you want to just eat sugar. Like it's just a bit of a natural thing. I also think,
and just to jump in there. So you were saying that he noticed these two researchers that were researching in the US about sugar and cancer and that feeding the cancer.
yes.
And those two researchers were finding that sugar was inflaming cancer and making cancer worse. And they were having, and they were experimenting by reducing the sugar diets of their patients. Yes. Okay. And they were having success with that. And he said, well, there's definitely something in this. And then he decided to, and that's when his sort of thought process started to really escalate.
Yes. Okay. And he looked at the patients, the diabetic menus in the hospital that he was working in, which comes under the government guidelines, actually encouraged 3 desserts per day to people with type 2 diabetes. So we're talking about people who can potentially have ice cream 3 times a day. Sugary ice cream, not non-diabetic. So when I was nursing, they actually had a diabetic menu, and it was a reduced sugar menu, reduced sugar jellies and different things. But here we've got people who are virtually eating carbohydrates from the minute they wake up to the minute they go to bed, and encouraged by dietitians in the hospitals who believe this is part of the guidelines and what they should be eating.
And presumably the rates of cancer were just getting worse and worse and worse, and no one was going into remission, and cancer and diabetes just getting worse and worse and worse, and more and more operations. And
yeah, and so as I said, because Gary's specific focus was on complications of type 2 diabetes within the hospital system, he also saw a lot of people with trauma and other things, but it just was hitting him that this was just becoming out of control. And so as he'd seen his own health improve by reducing sugar, and a few months later, because it took that long for his brain to remember that starchy carbs become glucose the minute you ingest them. So he started out just advocating or highlighting how much sugar was being served to people in hospital, and advocating the role of reducing sugar and cereal for brekkie, minimizing those things that are potentially causing out of control blood glucose in his patients that are in there already with the complications of type 2 diabetes. How can we stop this or minimize it and prevent it? So he became a very loud public health advocate in 2012 about the role of sugar. He did talk about cancer, but diabetes was much easier for him to talk about because he's an orthopedic surgeon and it was part of his bread and butter. And he didn't want to be doing this anymore. He didn't want to be looking after people who he felt were just being maimed by a disease that was caused by food and lifestyle. And he felt, he actually said to me, oh my gosh, Belinda, when I tell everybody this, he said, type 2 diabetes won't even be around in a year. He had no idea that there were a lot of forces. He was treading on toes he didn't even know where they are. And instead of everyone not having type 2 diabetes anymore, he was reported to the medical board by a dietitian at his hospital for recommending people reduce sugar, because that was against the rule books. So exactly why?
Strictly because it was so this person had, well, the dietitian just saw it as, you know, how he can't say this about, you know, our dietary guidelines. That you don't think there was well, you're going to, I assume you're going to tell us more about why, but that seems very, I'm curious about what the results were after, you know, the committee presumably, you know, said, okay, we need to look into this, or what happened then?
You would think they would just throw it out. But instead, it became a 2.5-year Star Chamber investigation into Gary talking about nutrition as a doctor. And if you think about it, Gary could recommend that people reduce smoking, especially before surgery, because it impacts the blood circulation to peripheral especially. And so when Gary was looking after people's feet, he needed their blood vessels to be as open and as elastic as they possibly could be. And smoking is shown to harden them and close them off. So he's not a respiratory person, but he can talk about the harms of smoking in his patients. He's not an exercise physiologist, but he can recommend to people that they do exercise, that they do other lifestyle-related diseases, lifestyle-related things to improve their disease. And for some reason, he couldn't talk about people reducing sugar. So my husband dug his heels in, and he was determined to fight this. But it's called the AHPRA, the Australian Health Practitioner Regulation Agency, and the Medical Board of Tasmania determined that Gary, from 2000, I think it was after he got his first notification, a little while after that, they determined he was not allowed to talk about this while he was under investigation. And so Gary had started a social media page called Gary, or I think it was just called No Fructose, Gary Fettke, No Fructose. And so when the medical board sent this thing, we worked out, because I'm a photographer and I'd done a lot of graphic design and things, we just changed his header on the Facebook page to Belinda Fettke, No Fructose. Not that it was my specialty. I did tell people, I'm really sorry, this isn't my forte here, but I'm going to talk about Gary being silenced, and I'm going to start talking about some of my research into why he's being silenced. And it had, I think, over 1 million views of that one post.
Wow.
People were just blown away that a doctor could be silenced from talking about something. So the medical board were not happy. They'd never been under scrutiny before. Most people, if you understand, when they get reported to the medical board, even if they haven't done anything wrong, there's a little bit of a suspicion. And so most people don't want the public to know that they're under investigation. This was about sugar. This is about people's health. So we just went, you know what? And the middle finger went up to the medical board. And we just got really, really loud on social media. And it was because of all the people on social media, because of these incredible people who questioned and wrote letters to the medical board, that I'm sure in the end, it also helped get Gary's name cleared.
And during that time, when you were getting loud on social media, was there any direct pushback from, because you were doing this presumably under your name now, was there pushback and you know, I want to say people trying to silence you directly?
I had a couple of groups that trolled, and some of them were quite nasty. And we had to sort of talk to our children and just say, I mean, they were adult children at the time, or young adults getting towards being adults, 17 and 20s. So we just said to them, just don't look. They're making these comments, putting up quite nasty things about Gary, myself, our businesses. But they were telling people to report Gary to APRA because he was still talking about it, not on social media, but in other ways. And yeah, it's quite a nasty space. But when it's the truth and when you truly believe it, and I think also the fact that I'm not medical anymore, and I was a wife, like when, I'm jumping ahead, but when Cyril Fabrecki came after my husband, the mama bear came out. You know, this was not fair. And when you realize that it's not just about dietetics and guidelines and it's about who's writing these guidelines. And I guess, Finn, that's where I started to stand up, because I was watching Gary. He was still talking at a low carb down under events and different things for a little while. Or he had been up until he was silenced. And I had watched all of these health professionals, people who'd seen changes in themselves adopting low carbohydrate principles, because that's where it moved on to, of course, after just reducing sugar. And seeing these people improve their health, improve health of their patients, and starting to talk about it publicly, I just went, why aren't the people who are changing the rules, the guidelines, and these guidelines aren't guidelines, they're strict rule books, why aren't they considering this incredible amount of information that's coming out with these guys? Gary pretty much contributed a thesis to the medical board over 2.5 years.
And just to lay out the timeline we're at now. So Gary has, he's seen all this terrible stuff unfolding with diabetes, people having amputations, the cancer rates. He's seen these guys researching in the US, and he's thought, great, we're going to bring this information to Australia and we're going to introduce it. And we're going to say, look how incredible these changes we are if we just cut sugar. He's then been reported to the
in 2014, yes.
In 2014. And then there's a 2-year sort of silencing window while he's being investigated that he's not allowed to speak. And it's during that window that you then said, look, we need to start talking about this on social media. We need to make some noise. That's when you started to make this noise. And the noise that you're specifically making is just around these dietary guidelines. And it's just around sugar, and it's just, or it's around pointing fingers at people, or what are the noises that you're making that
so I guess in 2014, it was about May, I think Gary was reported. And at first he was just trying to fight this. I was really busy with my photography business. But Gary also decided in 2014 that he could not be silent about this message. And if he couldn't talk to his patients about it, he had another dietitian come and speak to him and say, I'm really wanting to support people with type 2 diabetes using low carbohydrate or therapeutic carbohydrate restriction. This sort of thing is really, really important. I've seen great improvements in my patients. So Gary and Britt started Nutrition for Life in 2014, I think 8 weeks after Gary was reported. He said, then I'll have somebody at least who's a qualified dietitian to send my patients to. And so when Gary went back to work and got so busy again with work, I had to take over the running of Nutrition for Life. So I was full-time photographer, running Nutrition for Life, still had children that required a bit of care and running the house and everything else. And I guess, so I was really busy for about the first 6 months. And then after that, it just started questioning more and more. We were told there was an expert witness who'd been brought in to the medical board. And honestly, I thought, look, I've done research myself. I've never been trained in research. And I think maybe that's been a really good thing because I haven't stuck in that academic silo of thinking this is how you have to look and research and do things. I've just gone, this doesn't make sense. So I've just dug deeper and deeper. And so I started specifically looking at who this expert witness was. And I thought with cognitive dissonance, he must work for the sugar industry because why else is this going to be a problem? He was the biggest, I would say, gun in nutrition in the Southeast Asia Pacific region. Massive. He'd been the head of International Union of Nutrition Science. He'd been very involved with the World Health Organization and just really involved in guidelines and medical and dietetic training here in Australia. So he had to work for the sugar industry, surely. And so spent
Can you say his name or not?
Oh, it's been written up. Yes, Mark Wahlquist.
Mark Wahlquist.
Professor Mark Wahlquist. If you go onto my website, there's quite a bit written about him. And in fact, Jane Buxton, she's just written the Plant-Based Con in the UK. And she had to have a lot of verification about everything to be able to include his name in her book because she's written a bit about our story and some of my research as well. So yes, we can say it publicly because he came after my husband. Anyway, he didn't work for the sugar industry. He worked for the cereal industry.
Wow.
And of course, that just made complete sense. Gary's also starting to talk about not just sugar, but reducing processed carbohydrates. And looking into this sugar and cereal industry, really, they overlap a lot anyway. So it made sense. When I started to realize that for 20 years, this man had worked for a specific cereal company here in Australia called Sanitarium, I just thought, in the back of my head, yeah, I vaguely know that it's actually a church-owned cereal company because the Seventh-day Adventist Church founded Sanitarium back in 1897. And so I decided to start looking at, well, why does a church own a cereal industry? What are their beliefs? Why are they talking about all of these sort of things? And that has led to a huge minefield. But as